everyone, welcome back to our YouTube channel. This is episode 3 of my pregnancy series. If you have not watched earlier episodes, then I would recommend to watch those, especially TTC episode, which is trying to conceive. If you want to conceive faster and if you want to know the tips and tricks to it, then I would recommend to watch that video. It will pop up somewhere here. And in today's video, we talk about the tests and scans involved during pregnancy. What is the procedure here in Canada after getting pregnant? So without any delay, let's get started. Now, once you have confirmed your pregnancy on the home test pregnancy kit, after the 2-week wait period, which is really hard and very impatient period, I can understand and I can totally relate to that. Once you have confirmed your pregnancy, you can call your family doctor and book an appointment. This will be your first prenatal visit. You can just say that you tested on the home pregnancy test kit and it was positive. And later she'll order few blood tests for you. The first blood test would usually be to check your HCG levels. So HCG level is a prime indicator of your pregnancy. Your body won't have HCG levels if you're not pregnant. So that's the first blood test which your family doctor will order for you. In the same visit, they might also start prenatal vitamins for you if you have not started already. After confirming your pregnancy through the blood test, the family doctor might order another blood test to check the RH, your blood type, hepatitis, rubella, and if you are suffering from all these infections. So that will be blood test number 2. Then in later visits, he or she will refer you to the ultrasounds. So in the initial visit, you will be asked for your last menstrual period date, and then depending on that, they'll calculate your number of weeks and will suggest you to go for ultrasound. First ultrasound is dating ultrasound, which will check your first heartbeat of the baby, and this ultrasound is usually done within 7 to 10 weeks. So if you're sure about your last menstrual cycle, specifically the start date, then it will help better in calculating your weeks of pregnancy. Or if you are sure when you had ovulated, even that date you can mention to the doctor so that they calculate the number of weeks appropriately. So in the dating ultrasound, they'll confirm the gestation, that is if there is a fetus present in your uterus. So they'll check for the gestational sac, the gestation. Gestation is basically tiny baby. Before like 12 weeks, they just call the baby as gestation. So you just have to be aware of this term. So they'll check for gestation, they'll check for gestational sac. If the sac looks good and if the shape of the sac is proper, and depending on which week you are, they'll measure the length of the fetus from crown to rump, and depending on this length, they'll let you know how many weeks pregnant you are. And in this ultrasound, they'll also check the heartbeat of baby. So usually heartbeat is captured by ultrasound in 7th week. Before that, the fetus is really tiny, so it's really hard for the ultrasound machine to capture the heartbeat. So in the first ultrasound, it's fine if the radiologist is not able to capture your baby's heartbeat. You can go again for the scans after 10 days. They'll ask you to come back to check the heartbeat again. In this ultrasound itself, they'll check if there are multiple gestations, that is if you are having twins or triplets. So this scan is basically to confirm your pregnancy, the number of gestations that you are having, if you are having twins or triplets, and the heartbeat of the baby and the position of the baby. So sometimes it happens that people have ectopic pregnancy, where the gestation will start developing in the fallopian tubes, which is harmful. So if the position of the baby is not proper, then they'll ask for the uh, further steps. Now, once you're done with your dating scan, the next scan will be NT scan, which will be done around 11 to 14 weeks of your gestation. And in this scan, they'll check for Down syndromes and any genetic problems in the baby. NT scan is basically nuchal translucency. They measure the area around the neck of the fetus, and depending on what the range is, what the normal range is, they let you know the results. Also, for this scan, there is a blood test which is called double marker blood test, which happens on the same day. So if you have an ultrasound on a particular day, make sure you do this blood test on the same day itself. Now, next is Anomaly scan, which takes place from 18th week to 21st week of gestation. In this scan, they'll check for all the organs, if the number of organs or the external development of fetus is proper. I really enjoyed this scan because the baby is grown, like a full size grown baby, and you'll also notice the head, the feet, the external features so evidently on the monitor screen. So for both of us, we really enjoyed the Anomaly scan because we were able to see a full size grown baby, and all the external features like hands, fingers, toes were shown on the monitor, and the baby was moving. So it was really an emotional moment for us to see the baby in this scan. In the Anomaly scan itself, you will also get to know the gender of the baby. So make sure you mention that to the radiologist, and even discuss this before with your family doctor, that you would want to know the gender. And if you don't want to know the gender, it's fine. You can just mention these things beforehand, so that there's no surprise on the ultrasound day. Your partner can also participate in all these ultrasounds. Initially, the radiologist will check all the important things that she or he needs to check, and then they'll call your partner or husband. If they forget, you can remind them, because it is very important for both the parents to be present in those beautiful moments. Like for us, listening to the first heartbeat was very emotional moment. And then like I said, in Anomaly scan, we were able to see our baby move, and it was so active. So we really enjoyed that scan. Now I'm in my second trimester, so I am just aware of these 3 scans which happens. I think there will be a last scan which will happen in or after 30th week, to check the position of the baby, if the baby is head down or in breech position. But these are the important scans: dating scan, NT scan, Anomaly scan. Now here in Canada, you will not be referred to an OB until you have passed 20 weeks of gestation. So until 20th week, you will still regularly visit your family doctor. She might call you once 2 weeks. In the prenatal visits, if there are any scans that needs to be ordered or blood tests that needs to be ordered, they'll do that for you. And you can check them if you need to have a tetanus shot, which is very important, tetanus shot or flu shot. So check with your family doctor and remind them if in case they have forgotten. Now the doctor will call you once every 2 weeks for prenatal visits. If there are any tests or any ultrasounds which they need to refer you to, then they'll do that. Or else they'll just test your urine. They'll monitor the baby's heart rate, and then if you have any questions, then you can ask them during those prenatal visits. They'll check your weight, they'll monitor how much you're gaining. So this is the chart of weight gain, which is recommended depending on your BMI index. So make sure you don't put on too much of weight in first trimester. This will help you all along your pregnancy. As per my experience, the doctors here have been very helpful, and they'll address any of your silly questions. So please do ask questions. If you feel there's something off with your body, then please highlight those things with your family doctor. Now, there might be people who might not have a family doctor because there is a long waiting queue for family doctors. So in that case, you can walk in and visit the doctor. It's just that your history will be maintained, but not necessarily you will have that same doctor in your each visit. So it's better to have a family doctor. But then if you end up in a situation where you don't have a family doctor, then you don't need to worry. It's totally fine. You can still go for walk-in in nearby clinics. That's absolutely fine. Now, when I was in my 17th or 16th week, I guess, my doctor asked me for my preferred hospital. So you can give your preference of hospital to your family doctor, so that he or she will refer you to that hospital. You can check with your friends, family members who have gone through this process, and you can inquire about the hospitals, the number of rooms that is available, the type of rooms that is available beforehand. You do the research, and then you let your family doctor know where you want to register yourself for the hospital. Once your family doctor has referred you to a particular hospital, that hospital will call you for your first OB visit. They will schedule your appointment. Now there's a long waiting queue for each hospital, so it will differ like when you will get your first appointment. I was called for my first appointment in 24th or 25th week of pregnancy. So it really depends on hospital to hospital, and it's fine. Like, you don't have to get panicked because you're not getting the call. It's totally fine. Even though even in the OB appointments, if it's a low risk pregnancy, you don't have to worry too much about the OB appointment. Even in the OB appointment, they'll do the same thing. They'll just monitor your fetal heart rate, and then they'll check your weight. They'll check the circumference of the belly, and if you have any questions, you can let them know during that visit. I have usually observed that OB visits are very short and very crisp, so just make sure you have prepared your questions beforehand, because there you will not have time to think about the questions that you have. After the pandemic, I guess they have this rule of referring to an OB post 20 weeks of gestation, and it's pretty packed. Like, I have for each visit I've seen that the OB clinic is heavily crowded. And basically here, if you have a low risk pregnancy, it's not a big concern. And you might compare the situations with India. Like, in India we have ultrasounds in each month, but here it is not needed unless you have some red flags in your pregnancy, or if your pregnancy is inclined towards a high risk pregnancy. So the ultrasounds are really not that necessary here. Just the 3 ultrasounds which are very important. And at any point of time you feel like you're suffering from something which is very chronic, if you're having bad cramps or if you are bleeding, then you can anytime call 911, and you can go into the emergency and mention your concerns to them, and then the actions will be taken accordingly. Now, unlike India, here you have an option of midwife other than OB. So it's either OB or midwife, which you will prefer. I was new to this concept, and coming from India, I didn't know much about midwives. So I took some time to decide if I want to go with OB or midwife. And when I decided to go for a midwife, at that time I was put on waiting list, and I'm still on waiting list. But now I don't think I'm going to get through. And even the midwife association mentioned that if you are on waitlist even after 32 weeks of your gestation, then there's no use. So but just keep in mind that midwives are also very good, and they have everything similar to what an OB does. So they will order the tests for you, they will frequently have appointments and check you just like OB. It's just that they handle low risk pregnancy. So at any point of time, if your pregnancy is going towards a high risk pregnancy, if you have gestational diabetes and so on, then the midwives will refer you to OB. For midwives, you will have to call them immediately after you have conceived, so that they put you in that queue. And at 19th or 18th week of gestation, at least you will get through and you will be able to book the appointment. As far as I have seen, most people don't opt for midwives, just because just like how I was thinking, this is my first pregnancy, and I think I'm in better hands when I'm with OB. But that's not the case. Midwives also offer a good service, and I often feel like they are more stressing towards natural birth, so which is a good thing. And if you have low risk pregnancy, then it's better to go with midwife. This is what I felt, and this is what I have heard from people. Even that is an option. You can choose between OB and midwife, but you won't get both, like OB and midwife. So just be sure to make that decision as soon as possible in your initial days of pregnancy, I would say. So this was the video about the tests, the scans, and the process that is involved here in Canada during the pregnancy. So if you like this video, please hit the like button, and for more such information, do subscribe to my channel. See you in the next one.